Welcome to All Things Moore County, Moore County's weekly radio show highlighting the many facets of the Sandhills. That includes real estate, lifestyle, community and neighborhoods. And now from 4 Properties, here's your host, Bill Sahadi.
Good morning and welcome to the talk show, All Things Moore County. Dorothy, we have many facets of Moore County that we're going to cover today. A few weeks ago, we had Victoria Huggins on.
Yes.
And if you remember, she was talking all about the Alzheimer's Walk, which actually kicks off next Saturday, November the 12th.
Yep.
It was delayed due to Hurricane Ian. Mm-hmm. And there was a lot of confusion about Alzheimer's, and she did a great job talking about the caregiver's role, as well as what Alzheimer's is and what it isn't. And November is National Alzheimer's Disease Awareness Month and National Family Caregivers Month. So the event, the walk, is at 10 o'clock on November the 12th at Aberdeen Park.
Yep.
And we just wanted to remind people about that because that's coming up next week.
Yes.
And coming up in a few days, on Tuesday, November the 8th, is Election Day.
Fast approaching.
So a couple of weeks ago, we had today's guest on with the League of Women Voters, and they were talking all about vote411.org. And I understand that early voting has been up across the board, and my guest, Holly Powell, who is a volunteer for the League of Women Voters. She's also a volunteer navigator for the Affordable Care Act. Holly, is that?
That's correct.
Correct. Welcome back.
Thank you.
We spoke after the show. We taped with the League of Women Voters, and from what I understand, also this week started the new enrollment period for the Affordable Care Act, known as ACA.
That's correct.
Yeah. Dorothy, you can hear us okay, I hope?
Yes, I can hear you.
Because I hear sometimes I'm coming and going, and I'm not sure what's going on, but as long as you can hear me, we're good.
Yeah, you're good.
And Holly, you can hear me?
I can.
Okay. I was very impressed when you came in and spoke, Holly, about your involvement and the degree of your involvement with the League of Women Voters. I did not know you also were involved with the Affordable Care Act.
Yes.
It's been in place since 2010. We're in the 12th year.
Well, actually, it was passed in 2010.
Passed in 2010.
Yeah, but it wasn't actually implemented until 2014.
There you go.
So we're in our 10th year.
Okay. The enrollment period just started. For people who maybe are familiar with ACA or the Affordable Care Act but aren't really familiar with it, what does the enrollment period mean for people who might be listening?
So part of what the Affordable Care Act did was define when people could enroll in insurance. So open enrollment for the next calendar year runs from November 1st through January 15th.
Okay.
And if you enroll by December 15th, your policy starts January 1st.
And these are for people who are currently not insured?
These are for people who are insured currently through the Affordable Care Act on the Affordable Care Act marketplace, or people who aren't insured, or even people who might have an offer of insurance from their employer but want to see whether they can get more affordable insurance.
Through the Affordable Care Act. So there's a lot of movement at this time.
There's a lot of people checking things out.
How did you get involved with the Navigator Consortium?
Okay. So when I retired as chief of the contracting officer for the Marine Corps in Cherry Point in 2013, I didn't know what I wanted to do with the rest of my life.
Right. Write a book, make a movie.
None of those things crossed my mind, actually.
Okay.
But I was looking for something that would give me purpose and meant something to me.
Right.
And kind of coincidentally, I had breast cancer in 1987 and surgery and chemotherapy, which saved my life. And my husband had bypass surgery 12 years ago, which saved his life. So health care and affordable health care is very, very important to me.
Right.
And I found out that there was a volunteer organization right after the Affordable Care Act got passed called Get Covered America. And they were looking for volunteers to get the word out about what the Affordable Care Act did. And I joined as a volunteer. And then I wanted to understand more about how it worked because I always ask questions and I want to have a full understanding before I go out to try to spread any message.
Right.
And I was convinced then to become a navigator, which requires a background check every year and certification and extensive training.
So there's a deep belief that the Affordable Care Act is something that is a message that's worthy of getting out to people who are in need.
Yes, certainly. I think that it's very, very important for people to have access to affordable health care.
Yeah. A few years ago, I had a lady who had no insurance, and she was facing surgery. And she did not have the monies to pay for the surgery. And she went ahead with our prodding, and she signed up. She was able to get coverage. And because I think, and correct me if I'm wrong, because of the no pre-existing conditions, she was able to qualify. Whereas I think without the most insurance companies insist on having pre-existing conditions
excluded from coverage, yes.
So it saved her a ton of money.
Well, she wouldn't have even been able to get coverage for that if the law hadn't come into effect.
Right.
Yeah.
And I think she very quietly got to see the value of what it's all about, and we want to talk about that today. Like so many other things, people have an idea, but they don't really have the specifics, do they?
Right. And it's kind of gotten muddled as the years have gone on.
Sure
and I
has.
think people have kind of forgotten how it started. But it was actually an act called the Patient Protection and Affordable Care Act that was signed into law in March of 2010. It's known as the Affordable Care Act, or ACA, and a lot of people call it Obamacare.
Right.
Most of the provisions of the law were implemented in 2014. That's the first year that people could actually sign up for health insurance under the Affordable Care Act.
Yeah.
And I kind of want to talk about what the law did other than just make affordable health insurance available to a lot more people.
Right.
Because a lot of people aren't aware of this, that seniors on Medicare get a $250 rebate that helps close the Medicare Part D coverage gap. That's totally separate from being able to get insurance on the marketplace. So it affected people on Medicare. Okay, that's one thing.
Okay.
It also covers things from like free preventative benefits, cancer screenings, and an annual wellness visit under Medicare. So people who are on Medicare got benefits as a result of the Affordable Care Act.
That they didn't have
that
before.
They didn't have before.
Okay.
Another thing that's very important to a lot of people is that their kids can now stay on their plan until the kids are 26. So if you're a parent, as long as your child is up to age 26, they can stay on your plan. Like if you have an employer-sponsored plan, even if that child is married, even if that child is not a tax dependent, even if they have their own children, they can stay on your policy until they turn 26. So that's a huge benefit for a lot of young people, that they can stay on their parents' policy. So just a few other things are that insurance companies have to provide health insurance to any adult aged 19 to 64 who applies.
Right.
There's no underwriting, so there's no consideration of your past medical history, and nobody can be denied coverage or charged more based on their medical history. So that was a huge, huge change in the health insurance marketplace in terms of how insurance was sold and bought. Insurers are not permitted to exclude pre-existing conditions, just as you already mentioned.
Right.
All of the new health insurance policies must cover preventative care and pay a portion of preventative visits. It eliminated the lifetime and annual limits on coverage. So before the Affordable Care Act, a lot of people might have had insurance, but once their insurance paid a certain amount that year, they'd quit paying, and you had to pay everything.
Right.
Same thing for lifetime caps. Those are gone. They're prohibited. Also, insurers cannot cancel a policy when you file a claim, except in the cases where a consumer commits fraud or misrepresentation.
Sure.
So your insurance can't be canceled, nor does the price of your insurance go up just because you have insurance claims. Insurance companies also have to provide a process for customers to make an appeal if there's a problem with their coverage. So if you think something should have been covered and it wasn't, you have an appeal right, and they have to tell you how you can appeal. A couple other things related to businesses. Small businesses can get tax credits up to 50% of the premiums that they provide on behalf of their employees.
Mm-hmm.
And large businesses with 50 or more full-time equivalents must provide affordable coverage that meets what's called the minimum essential standard for their full-time employees. So there are laws that affect employers. The Affordable Care Act actually affects it. Another thing a lot of people don't know, insurance companies have to spend at least 80% of their premiums on care. And if they don't, the consumers under that policy get a refund. So ever since the Affordable Care Act came into effect, that's been true.
Sounds like the Affordable Care Act became an instant consumer watchdog.
It did in a lot of ways, for health insurance,
for everybody.
Yeah.
Whether you're working under the umbrella of ACA or whether you had a private insurer, all of a sudden that private insurer now has to be more consumer friendly?
Yes.
Right?
Yes, a lot of consumer protections in the Affordable Care Act, no matter how you get your health insurance.
Gotcha.
So the one part, and this was related to the open enrollment period. So one thing that you can't expect insurance companies to do is to provide coverage if people only enroll when they get sick, right? So that's why there's an open enrollment period. So open enrollment, even if you're getting a plan directly from an agent and it's not on the Affordable Care Act marketplace, open enrollment runs for that period that we already mentioned, November 1st through January 15th.
Okay.
If you don't enroll during that period, but you want to enroll during the other part of the year,
okay,
then you have to have a life event that qualifies you. Like you moved, you got married, you lost your employer insurance, or something happened that entitles you to that special enrollment period. So this is separate from employers who can have their own yearly coverage period. It may be a calendar year or it may be something different. But if you're buying a policy other than through your employer, this is your open enrollment period to get it for 2023.
And people today can shop. They can go through an affordable ACA program or a non-ACA program.
Okay, we're going to talk about
in the open
that.
marketplace.
We're going to talk about that.
Okay, because I'm thinking about costs and what, where are the best benefits, but people can be free to choose one or the other. Is that correct?
So there's lots of ways to get enrolled.
Okay.
And real quickly, I can talk about what those are. So you can still go to an agent or a broker.
Yeah.
And they can help you enroll on the marketplace.
Right.
Or they can sell you a policy that's not on the marketplace, but they're still the same insurance policies. But only if you go and check it out on the marketplace can you find out if you're going to get one of the big benefits, which is a tax credit to help you pay your premium.
And that would be under the ACA?
Okay, so this is one of the things that the ACA did to make insurance affordable.
Okay.
Is to use people's incomes
Right.
to determine if they're eligible
Right.
for a tax credit to help pay their premiums.
I understand. And that wouldn't happen outside of that marketplace.
That's correct.
Okay. I'm asking questions with trepidation because there's so much of it I don't understand. But you're ready to clarify, I think, everything. So you're going to hear me go, we're going to come back in the second set. Holly Powell is our guest. We just started the new enrollment period a couple of days ago, and she's here to talk in depth about the Affordable Care Act, which is a value for everybody, whether they've been privately insured or whether they're shopping for insurance at this point. This is All Things Moore County. Welcome back to our second set of All Things Moore County. Holly Powell is our guest. We're talking all about the Affordable Care Act. Holly, there's a lot of information that you have been giving out. It's almost like sitting at a smorgasbord, and it's hard to all digest. So before we even get into it in a little more depth, what about people who are listening who want to get more information? It's just a lot to take in all at one time.
It is. Thanks for asking. So I do want to talk about the North Carolina Navigator Consortium, which is led by Legal Aid of North Carolina.
Yep.
This organization offers in-person as well as remote Zoom and phone appointments. I'm one of the navigators who provides those appointments. And you can go online 24/7 to ncnavigator.net.
Okay.
Or you can call 855-733-3711 to schedule an appointment.
Okay. Are you ever on the end of those inquiries?
I don't answer the call line. I'm the one who has appointments available in the scheduler that they then hook up people up with.
Okay. I won't tell you how many years ago I turned 60. I think I had one surgery my whole life. I said, wow, I beat it. Ask me now, I'm like, oh my gosh, I'm convinced that being well insured, properly insured, is the best defense that someone has to protect what they've spent their lifetime building up. And I'm sure you have seen situations that have not gone that well.
Well, I have to say, after I completed my whole career and started doing this as a volunteer, this has actually been the most rewarding work that I've ever done.
Right.
I've had 3 people over the years who told me in subsequent years after I helped them get insured that they were sick. Had they not had insurance, they wouldn't have gone to the doctor, but they did.
Right.
They were diagnosed with cancer. They got treated, and they are fine.
Yeah.
That's the most rewarding thing I've ever done is help people get access to that health care.
Right. People hope to be lucky and beat the system, but that's not, that's short-term thinking. And what you're laying out is an opportunity for people to get affordable coverage, more balanced coverage, that this did not exist 10 years ago.
10 years ago.
Right?
Yep.
Crazy.
So let's talk a little bit about the goal of the Affordable Care Act. We're talking about getting affordable health insurance.
Yeah.
That is accomplished by offering subsidies, which are called tax credits, to help pay your premiums. And also people at certain income levels also qualify for something called cost savings reductions. And that means they have a lower deductible and lower copays or coinsurance. So depending on your household income, for the upcoming year, like right now we're talking about getting coverage for 2023, you do an application and you enter information about the individuals in your tax household as well as their projected income.
Mm-hmm.
And then based on that projected income, the system actually calculates how much of a tax credit that you are entitled to and whether you qualify for these cost-saving reductions. And then you actually go and look at the insurers that are available and what plans they're offering. And these are county-specific plans. So what happens is in the summer before an open enrollment period, insurers come in to the North Carolina Department of Insurance and detail the offerings that they plan to make in each county in North Carolina and what they plan to charge for their premiums. The premiums under the Affordable Care Act on the Affordable Care Act marketplace can only be based on age, geographic location, and whether you're a smoker or not. They are allowed to charge a premium for smokers.
Yep.
So it doesn't matter what sex you are. It doesn't matter what your medical history is. Nothing else matters. Your age, your geographic location, and whether you're a smoker. And that's the entire basis for pricing the premiums. So your income determines whether you qualify for a tax subsidy.
Right.
And then after the year is over, you do something called file your taxes and reconcile that tax credit.
Right.
And if you made more than you estimated, you might owe some of the tax credit back.
Makes sense.
And if you made less, you might actually get a refund.
Makes sense.
Okay.
Yeah, that makes
So
sense.
that's kind of how it works. Now, one of the important changes that is continuing. Originally, when the Affordable Care Act was passed, if you made more than 400% of the federal poverty level, you couldn't qualify for that tax credit.
Okay.
And for instance, like for 2023, a single person makes 400% of the federal poverty level if they earn $54,360. That kind of gives you an idea where that level is.
Okay.
So the American Rescue Plan removed that limit in 2021. So now there's no upper threshold for people qualifying. And now it's a percentage. You're never going to pay more than a certain percent of your income for your premium. And the more recent Inflation Reduction Act extended that provision through 2025. So we used to call it the cliff. If you made over 400% of the federal poverty level, you could still buy insurance, but you had to pay the entire premium.
Okay.
So now that's not true. You just won't pay more than a certain percentage of your income.
Okay. So the person who made the $54,000 today versus 4 years ago, tell me the difference.
They are going to get a tax credit of, I can't tell you a dollar figure because it's based on, it's a little bit complicated, but it's based on the second lowest cost silver plan in your county. So the plans are, there's a catastrophic plan, there's bronze plans. That means bronze typically has an actuarial value of the life insurance, the health insurance companies paying 60% of typical costs for health care, and you're paying 40%.
Okay.
Then there's silver, which is a 70-30 split. There's gold, which is 80-20, and there are sometimes some platinum plans, which are 90-10. As you go up in metal, what we call metal level,
Right.
the premiums are higher, but what you're going to actually pay for your health care is lower.
Okay. It sounds like this plan has a wide net, a reach, and it's like the great equalizer, or it's trying to be fair to people of all different levels. That's what it.
Yes.
In between the lines.
Exactly.
Okay.
Exactly.
Okay.
And if for those people who have income up to 250% of the federal poverty level, which, for instance, for a single person this year is $33,975, they get those cost-sharing reductions, which help keep their deductible and their copays low. So again, if they enroll in what's called a silver plan. So this is, again, helping people have access to care for lower prices.
Okay.
A couple other things. All these plans that are offered in the marketplace cover 10 essential health benefits. I'm not going to list them all right now because of time, but all this information is available at, we should be saying this throughout the program, healthcare.gov is the website. So healthcare.gov is where you can actually go on your own and apply. You can do something called preview plans, and you can do that right now and all through the year without even creating an application. You can enter some basic information and see what you qualify for and what's available in your county and what the premiums would be. But before we go further with that, I kind of like to dispel some myths about what the law didn't do. The Affordable Care Act didn't take away anyone's employer-sponsored insurance. It didn't eliminate that. It did include some of the things we've talked about that now apply to insurance through employers. It didn't nationalize health insurance or create a public option. That was one of the things that was discussed when the law was being debated. It didn't eliminate health insurance companies. So the insurance policies available on the marketplace are from insurers like Blue Cross Blue Shield, like Aetna. These are regular insurance companies that people have bought health insurance from for years, right? So these are regular insurance policies from insurance companies, some of which are nonprofits, some of which are for-profits. Another thing the law didn't do is it didn't change Medicare except to help people save money when buying drugs, and it added some services that are available to them. One thing that it did do, which North Carolina hasn't been able to take advantage of, the law actually expanded Medicaid to cover a lot more people, those earning up to 138% of the poverty level. But the Supreme Court later ruled that the states couldn't be forced to accept the Medicaid expansion. So North Carolina is one of only 12 states that haven't expanded Medicaid. And that means that about 500,000 to 600,000 North Carolinians have no insurance coverage. They can't get a tax credit on the marketplace to help them pay, and they can't qualify for Medicaid. This includes veterans, working poor, and many adults with no minor children in their home. A lot of people think if you make too little, you're going to get Medicaid. And if you make too much or more, you're going to get maybe the Affordable Care Act insurance on the marketplace. But if you're a single adult and you don't have any kids at home, and your projected income for next year is less than $13,590, or a married couple with income less than $18,310, you don't qualify for Medicaid or for tax credits to help you buy insurance.
So it's got to come out of pocket.
Or you're uninsured. Or, I mean, thank goodness for people in Moore County, they have the Moore Free and Charitable Care Clinic.
Right.
But that's all there is for the people that fall in what we call the Medicaid gap.
Okay. You mentioned the website, healthcare.gov.
Yes.
How intuitive is it?
It's way better than it was when it started.
Didn't start out so well.
So you basically, it's stepwise.
Yeah.
You create an account.
Yeah.
It verifies your identity.
Yeah.
It uses actually information from your credit report to ask you those questions, like
your mother's maiden name and your pet dog.
It's more than that. But, like, did you own this car, and was this your phone number, and those kinds of questions. Okay. But once it verifies your identity, then you just go through screens. Yeah. Now, you can do it online at healthcare.gov, or you can call the marketplace and do it by phone. Okay. But basically, anybody can do it. Now, I usually advise people, if they've never done it, unless they have a very simple situation and they can easily estimate their income, that people that don't fall into those categories, I would recommend that they get help at least the first year that they apply. And from a navigator, or they can get help from an agent or a broker.
Okay, we're going to take a break and come back in the third set. The website is healthcare.gov. You can also go online to www.ncnavigator.net. This is All Things Moore County. Welcome back to our third and final set with Holly Powell. Fascinating conversation. A lot of information about the Affordable Care Act, and it's a lot to unwrap. And to listen to it on a radio, as opposed to sitting in front of your computer screen and going to healthcare.gov, is a different way to take this in. If someone's driving and listening, they have a lot of work to do. They have a lot of homework to do. What are there now? 13 million Americans who are covered?
13.6 million were covered in 22.
In 22.
Yeah.
You expect that number to go up quite a bit, I would think.
I do think it's going to go up this year. I'd like to note that in 2022, North Carolina had the highest number of enrollments since the beginning of ACA. We had 670,223 people in North Carolina enrolled.
What do you attribute that to?
I should mention that the North Carolina Navigator Consortium operates under a grant from the federal government.
Okay.
And we've done a lot of outreach. Doing radio shows like this is one of the ways.
Obviously, it's working, yeah.
And we do advertising. You may have seen ads. I've seen them on TV about the Affordable Care Act and the North Carolina Navigator Consortium. So we're using that grant money to get the word out about the availability. And I can mention that this year in Moore County, we had 5,436 enrolled. 93% of them got a tax credit to help pay their premium.
So that group was at the lower level, and they were able to get something they may not have been able to afford without it.
Yes, I need to mention that basically 9 out of 10 people get a tax credit that apply.
Okay.
Yes, and many people are able to get a high quality plan for $10 a month with that tax credit. So we're talking about getting very, very affordable health insurance.
So prior to all of this, prior to 2010, going back to the 70s, 80s, 90s, people couldn't afford insurance in this country. There were people who were insured and there were people who were not.
That's correct.
So we've reset the tone here, for sure. Now there's that opportunity for people.
Right.
Okay. Do they trust it?
I think maybe the first year somebody
Yes.
seeks coverage. They're not too certain about exactly how it's going to work.
That's right.
I have many consumers that I've helped all 10 years. And I'm now making appointments with those people to help them during this open enrollment.
What do? Do you consult with them on the phone? Do you meet with them?
So when we started out, at the beginning, they were all in-person appointments.
Yeah.
And I would hold them at places like libraries or clinics.
Okay.
When COVID came,
Yeah.
we went to remote.
Right.
And we do appointments by phone or by Zoom.
Right.
Zoom works really better because you can actually log in together into the healthcare.gov, and they can see your consumer can see the screen, and you can talk through the questions and compare the plans. We can't pick a plan for a consumer, but we can help them compare the plans and talk to them about what's most important to them. And there are a lot of tools within healthcare.gov that allow you to do plan comparisons, and a lot of different filters you can use to look at those plans. So I would say sometimes people will do the application on their own, but when it comes time to pick the plan, they'll call one of us to make an appointment to get some help comparing plans. Again, we can't tell them which one is best, but we can help them compare and contrast.
And they make the decision.
And they make the decision.
As to what's best for them.
Right.
So this program needs advocates.
It does.
To help educate, right? Because
Right.
this is foreign territory to a lot of people.
It is. I should mention that, just in general, all U.S. citizens who live in the U.S. and people with documented immigration status
Right.
can apply, except those who are already on Medicaid, unless their Medicaid coverage is ending. Those on Medicare, they don't qualify for coverage on the marketplace because they have Medicare.
Okay.
As long as they have free Medicare A. Now, there are some people who don't get Medicare A for free because they don't have enough work quarters. So if you don't have, as long as you have free Medicare, you're not going to be going on the Affordable Care Act marketplace. Or if you have TRICARE or VA coverage, or if you're incarcerated, you cannot use the Affordable Care Act to go on the marketplace. Those people who have employer-sponsored insurance, as long as their employer-sponsored insurance is no more than 9.21% of their income,
Right.
they aren't going to be eligible for a tax credit on the marketplace.
Okay.
But if you're uncertain, basically you do a marketplace application and you enter in the cost of your insurance, and we actually have a form that you can get that information from your employer, and you enter that in the system, and it will calculate whether you're entitled to the tax credit or not, so that you can see what your choices are. And I have helped quite a few people who had offers of coverage from their employer, but it wasn't affordable for them, and they were able to get coverage on the marketplace with a tax credit.
And the coverage on the marketplace on ACA is better if they leave their job. I mean,
you mean if they leave their job
if
insurance?
yeah.
Not necessarily better.
Okay.
Because every employer's, a lot of employers offer a variety of plans.
Okay. Okay.
And it all depends, they price them differently.
Okay.
So you can't make a generality about that.
Okay. All right. It's, again, I'm just trying to take it all in, and nothing but questions that come up. That's why this is like having your taxes done, complicated.
It is.
You need an accountant to help you get from here to there to finish the paperwork. It's the same thing here.
Well, I often say to people, the last thing I ever wanted to do was taxes, and if I had known how this was tied to taxes and how complicated it was, I probably would have never started.
That's right. That's right.
We need to mention the difference between the ACA and Medicare. So let's talk about that, because we're in an open enrollment period for Medicare. So if you have Medicare, that open enrollment runs October 15th to December 7th. And just like the Navigator Consortium that helps people with Affordable Care Act, we have something in North Carolina, well, actually it's nationwide, called Seniors Health Insurance Information Program, or SHIP. And we have counselors in every county, and ours in Moore County are at the Senior Enrichment Center. And they'll provide you with one-on-one help exploring all the options you have under Medicare.
Okay.
So do you want me to give the phone number for that?
Yes, please.
So the Moore Enrichment Center for the SHIP counselors is 910-215-0278. And again, that open enrollment period ends December 7th. So if you want some help, you need to call them and make an appointment so they can sit down with you and go over your choices for Medicare.
Okay. We were just talking, I think I've been getting inundated with mail on my Medicare, that it's an open enrollment period every day. I mean, emails, snail mail. It's a confusing time. There's so much information out there.
It can be just as hard to figure out, if not harder, than doing the marketplace application, because there are a lot of choices to make, and some of them affect you. How you make that choice could affect your future ability to get coverage at a certain price.
Right.
Yeah, so that's really important to get help with. So I wanted to talk about a few of the messages about this Open Enrollment 10, which, boy, that sounds like it's been around a long time, but
Right.
we're so excited about it being Open Enrollment 10. Again, it runs November 1st through January 15th, but if you want coverage to start January 1st, you need to enroll or renew by December 15th.
By December 15th. Okay.
So a message that we want everybody to get every year is that current enrollees on the marketplace need to return and actively renew, because insurers change, policies change, premiums change, tax credits change every year. So if you've done your application and answered questions in a certain way, your coverage may be able to roll over, but it may not, and you may not like what you end up with when
Right.
it rolls over automatically. So we always encourage people who are enrolled for the current year to come back
Okay.
and reapply. Basically, you just update your application.
Do they do that?
Yes,
They do
they
that.
do.
Okay.
I've had people I've been helping 10 years. This
Oh,
will be my
wow.
10th year.
Okay.
So I reach out to all the people I've helped before and say, it's open enrollment. Do you want an appointment?
Okay.
And one of the things that's most important, I really want to stress this for Open Enrollment 10, is that a change to the IRS regulations has just gone into effect for 2023 coverage that's going to make more people eligible for the tax credits so that insurance is affordable. And this is probably going to surprise you, but because of the way the law was implemented, if somebody in a family had an offer of employer insurance, the way the marketplace looked at the cost for that family in terms of whether they qualified for a tax credit was based on the cost of insurance for only the employee, not the rest of the family.
Okay.
So if that cost was considered reasonable, which this year would be 9.12% of your income, just for the employees' coverage, you couldn't get a tax credit for anyone in the family on the marketplace.
Okay.
For the 10th year of open enrollment, that has now been changed so that the employees' coverage will still be compared to that 9.12%. So if you have affordable coverage for the employee, they won't get a tax credit. But the rest of the family,
Yep.
the spouse,
Yep.
the children,
Yep.
are now going to be eligible for a tax credit based on the cost of family coverage under the employer plan.
That's good news.
It's wonderful news, and it's estimated that about 5 million more Americans are going to qualify for a tax credit now. So this is a major message we want people to get for OE10, or what we call Open Enrollment 10.
There's no way we could cover everything that needs to be covered on an hour radio show, but we can. You want to give the information one more time where people can go if they have questions. It's healthcare.gov. That's where they start. But what if they want to start with you or someone like you, an advocate?
So you can go online to ncnavigator.net, or you can call 855-733-3711.
Right. All the people you work with are volunteers?
Some are employees of legal aid, and
Okay.
some of them are navigators, but then we do also have quite a number of volunteers like me.
So people should start like right away.
Yes, they should go
period
ahead and check.
tomorrow.
Look, go to ncnavigator.net or call the phone number, and basically they're going to ask you your zip code. They're going to try to locate a navigator near you, and then you can say whether you want an in-person, a Zoom, or a phone appointment, and they'll make you an appointment.
Holly Powell, thank you so much for coming in. What a great service you're providing.
Well, thank you so much, Bill. Thank you for having me
Oh,
and
yeah.
giving me this opportunity to talk to people.
I hope, and I hope people will reach out to you through your organization. This is a time to do it between now and December 15th.
Yes, and even if even goes on to January 15th, but if you wait until between December 15th and January 15th, your coverage would start February 1st rather than January 1st.
Gotcha. Holly Powell, thank you so much.
Thank you, Bill.
This is All Things Moore County. Have a great week.